Well, disparities in terms of care affect pretty much every area of medicine and every area of sleep medicine as a subspecialty. There are delays to diagnosis, delays to treatment, treatment options that are available to people in terms of what they can afford, what they can't afford. So, taking these into consideration and having an awareness that there are barriers to care that patients have will impact not only your ability to diagnose and treat them, but maybe get them through the process a little bit faster. There's, one of the biggest hurdles in the treatment of the central disorders of hypersomnolence is getting people diagnosed, and that can take years to get people in the clinic and get them evaluated, and then get them started on treatments, and then the treatments that are available once you do diagnose them, what can people afford? And so that's also something that's really important to consider in terms of, okay, are we going to use the newer medications, or are we going to stick to some of the more generic medications? Because even if you have newer medications that are being developed, if you have a patient that can't afford them, then they're really of no utility in the patients that you're treating. So the tried and true medications that we're using, we still need to be familiar with because they're affordable, they're generic, and people can use them. And so I think that's those were some of the biggest takeaways from that article in terms of looking at that and just trying to describe my own clinical experience of seeing patients in the clinic. I see patients every day, and so this is, these are the barriers and the difficulties that we encounter in treating patients, not only in sleep medicine, but across medicine in general.